Pain. I want to address pain because, especially in the clinical setting, this was one of the biggest problems. And most people never connected resolving their pain with movement. Again, it almost seems a little counterintuitive because you don't want to move when you hurt, obviously, because it just hurts worse. I want to address how we think about pain and how we address pain, especially in this country, because it is backwards. Okay? So are you just waiting for something bad to happen? Many of us just wait and do not pay attention to our body until we actually experience a symptom that gets in the way of us checking the tasks off our daily list. Until there's a problem, we just completely ignore our physical structure. Again, I'm not saying it's everyone, but this is the vast majority of people. Physical activity, pain, is a perfect example of this. When you get out of bed in the morning and you hurt morning after morning after morning, or when you're sitting in your chair and your back is killing you, that's when you finally pay attention. Because something is annoying you. But we're not paying attention beforehand when we could have prevented the pain to begin with by moving. Because we think exercise is for losing weight, and I'm just not motivated to lose weight right now. But we can get motivated for structural health. So our backs don't hurt, and our vertebrae are in line. So we don't have degenerative disc problems, so we can't move later on when we'd rather be on a cruise ship or hiking in the Himalayas or something exotic, opposed to sitting around in your house because you just can't go on vacation because you just know physically you can't do it. Exercise is worth it. Remember, how many minutes? 15. 15 makes a big difference. Pain is a signal from the body telling us that something needs attention. This is what pain is. It's a gift. What do you think would happen if you didn't have pain receptors? Say a disc starts protruding into your spinal cord, one of the discs between your vertebrae. It starts hitting the spinal cord. Say you don't feel it. What are you going to keep doing? You're going to keep doing what caused it to happen in the first place, aren't you? And then guess what's going to happen? That disc will burst straight into your spinal cord, and it will begin to affect every function from that point down. That's a big problem. Without pain, you wouldn't know to pay attention to it and to start seeking out a solution. Pain is a gift, and we need to begin to look at it that way, because if you do, you will then look to pain to start guiding you in how you resolve the pain and resolve the problem. Pain is not the problem, and you don't want to kill the pain. Okay? That's an important fact. We're going to talk about why in just a little bit. So this gives us the opportunity to pay attention. The pain is an opportunity. Most people ignore pain because it's not too bad yet. It's not interrupting my life enough yet. I'll just ignore it. Or we cover it up with over-the-counter drugs. We are actually taking a chemical to stop the pain receptor from sending the message. How many people think that solves anything? It doesn't solve anything to stop the pain message, does it? You can't solve the problem that causes the pain by just stopping the pain. You've got to get to the root of the problem. So we have to stop thinking that we can just take an over-the-counter drug and just dull the pain so we can get on with our day. Thinking that somehow the problem that's underneath there is not going to get bigger and bigger just because we got the pain to go away for a short amount of time. This is an interesting kind of statistic here. 50% of all office visits in family medicine are coded, whether it's the ICD-9 code or the CPT codes, are a physical pain problem. 50%. Anyone here heard about a unsustainable healthcare system that we have, costing us more money than I think we even produce here in a year? Medicare is $37 trillion underfunded now. Who's paying for that? You. And 50% of these visits are coming from physical pain problems. Myth number 8. Your family care doctor will help you resolve these problems. This is not a bash on family medicine, by the way. This is for you to understand what a family medical doctor can do and actually be honest with yourself about how you need to seek out treatment. Can anyone guess what a family doctor can do for pain? You can get a pain medication. You might get a referral to a physical therapist, although your insurance probably won't cover it at that time unless you have a real diagnosis other than just pain. Or you're going to get referred to a specialist. How many people know what the specialist can do for you? You're going to get imaging. You'll have MRIs. You'll have all kinds of radiation exposed to your body. And eventually it'll come out saying you've got something that, well, we can't operate on it. Or we could operate, or maybe they want to operate on it. When it comes to your family physician, they do not have resources to help you resolve, truly heal what is causing your pain. They don't. We need to start thinking about what professionals can help us get in order and realize that you actually are the number one person that can eliminate your pain through movement. Number 9, taking pain medications or over-the-counter medication for long periods of time makes sense and is safe. The reason that I get so passionate about this is because so many of you are doing it. And you do not realize the consequences of popping a Tylenol and an ibuprofen and an naproxen every day or every other day. You do not realize the consequences of these things. I want to touch base on them real quickly. In a study published this year, actually, in the Archives of Internal Medicine, it was a study that was done on 125,000 people, so it was pretty significant. And it came out, and the conclusion was long-term use of non-steroidal anti-inflammatories, NSAIDs. You've all heard of that class of drugs. That is the most common over-the-counter pain medication. Long-term use is associated with cancer. They're finding links, significant links. Do we have a cancer problem in the United States of America? I can promise you none of those diagnoses. The doctors looked and said, are you taking non-steroidal anti-inflammatory drugs? Because we're not looking for a cause. The British Medical Journal published a study. Pain medicine and NSAIDs, non-steroidal anti-inflammatories, increase risk for atrial fibrillation. Has anyone seen the new drug commercials for drugs for AFib? Ever heard that joke about take this medicine and then have to take the next one for the side effects of what the one is causing? Deaths on the rise. This one was published in August. This was also published in the British Medical Journal, and it looked at deaths from opiate drugs, painkillers, serious pain medication for people who have chronic pain. Between the years of 1999 and 2007, they went from 14,041 deaths directly associated to 2007, or 4,041 deaths in 1999 to 2007, 14,459 deaths. Does anyone know what percentage increase that is? That's 350% increase in deaths from these drugs. Pain drugs. most of this pain is preventable through lifestyle. I want to make sure that that's getting across. This was an interesting one that I read too. Anti-inflammatories kill more people every year than AIDS, asthma, or leukemia. Anti-inflammatories or painkillers kill more people than those three diseases. Having a little different thoughts about popping a pain pill, aren't we? There are consequences. You can't just put something in your mouth and think you're just getting rid of the pain and nothing else is going on. And then in the Journal of Surgery, published in July, NSAIDs increase risk of cardiovascular events. Taking non-steroidal anti-inflammatory drugs affects your heart. Because a lot of the research articles that I looked at regarding pain medication, and especially anti-inflammatories and painkillers that people pop normally, a significant amount of them had to do with what was going on with people's heart function. I want you to understand this fact, though. Okay? If you need to utilize an over-the-counter to mediate the pain so that you can move and walk to an acupuncturist's office or a chiropractor's office to begin rehabbing the issue and actually solve it, then use them with the guidance of the person you're doing rehab with. Because you need to be able to move to rehab the issue. And sometimes you need to cut the pain a little bit to do it. They will know how much you need to take, and they can help guide you so that you don't take too much and numb yourself and not know if the rehab is working, or overdo it and hurt yourself even worse. That's one of the biggest issues in this class of drugs, is because most people take so much, their pain threshold goes up, and they end up furthering the actual damage and dysfunction that was causing the pain in the first place. So the damage then becomes more permanent and it becomes more significant. Myth 11. You should wait until your body hurts to pay attention to it. Obviously, we just kind of went over this. And I'm going to cover this in Medicine Revisited, Lesson 11 as well. Because most of you do not go to a chiropractor unless you have issues in your back. Most of you do not go to an acupuncturist until you have a freaky problem that no one else can fix. So you're going to go see the weird acupuncturist because you'll do anything to get rid of it. We're going to begin to talk about a preventive maintenance plan. I went in and saw my chiropractor today, and I didn't have any pain in my body at all. And I go in and I see him about once a month or once every 6 weeks, because that's all I need to see him for just a general health and wellness maintenance plan. Because I also have a movement plan, I eat well, I take care of my environment, I take care of my mind. You should not have to seek out a practitioner that wants you back every week or every other day. Unless you have a problem that needs healing, you should be looking to set up a schedule, though, where you go and see them where they can help you out before you have pain. And I like the little analogy here. Waiting for pain before taking physical action is like waiting for someone to hit you before you duck, just to make sure the punch was coming. Do not wait for the punch. Because if you do not do something about your physical health, the punch is coming. The statistics show it. Most people will have a significant pain issue in their life at some point in time. That's what the data says right now, and it's because of how inactive we are. The more active we are, we won't have to deal with that. So we need to head it off. Myth number 12, surgery is mostly successful in solving the cause of problems and is safe. How many people like the idea of having the fascia along your spine cut? How many people like the idea of anyone, I don't care if they've had 35 years of school or not, anywhere near your spinal cord? How many people like the idea of being put to sleep? Wouldn't we want to avoid this type of stuff if we could? I've had surgeries before. I know what it's like coming out of there, being in intensive care, not knowing where you're at or what's going on. That was something I couldn't have provided. That was a pitchfork through the wrist. I couldn't have prevented that one from happening. But there's so many people going through these things that don't have to, because the issue they're in there for was preventable. Had they paid attention and anticipated the punch in the face and ducked, had they gone out there and moved, they could have avoided the damage. They could have avoided the surgery, the pain. Alignment. I want to hit alignment really quickly because movement helps to naturally keep your body in line. So when you're not aligned, when your nervous system isn't completely aligned, when you're not running extremely efficiently, you have abnormal wear on joints and cartilage. How many people think if a bone is sitting off a little bit, do you think constant pressure on that every single day is going to wear it weird? It's going to wear it out, isn't it? Because it's not meant to be off like that. It's meant to be right on top of each other. And in that position, nothing bad happens. It regenerates itself. It stays perfect. When you get out of alignment, whether it's your spine, whether it's your hips, your knees, when you get out of alignment, it causes major joint problems. And this can be very easily avoided. Okay? Interruption in communication between the brain and other parts of the body. You get misaligned in the spine, you get a little kink like that, you can affect all kinds of functions in your body. Do you know that your organs are connected to your brain through your nerve network and your spinal cord? You can change an organ's ability to function. You can impair it by being out of alignment. Inactivity causes this big time. Miscues in organ function, we just talked about that, and reduction in food absorption and assimilation. We are finding out more and more and more now about the nervous system and gut health. That your gut health is actually directly connected to your brain and brain activity through the vagus nerve. And that when you have issues with your nervous system, you are going to be affecting your gut health big time. So alignment is very important. Okay?